How does pelvic inflammatory disease cause tubal factor infertility? Pelvic inflammatory disease is an infection that affects the female reproductive organs, especially the fallopian tubes. It is often caused by bacteria like Chlamydia trachomatis and Cilia gonorrhea, which are common sexually transmitted infections. When these bacteria infect the fallopian tubes, they cause inflammation, a condition called salpingitis. This inflammation can lead to several changes that interfere with fertility. One major way PID causes tubal infertility is through scarring and blockage of the tubes. The inflammation triggers the formation of scar tissue inside and around the tubes. These scars can partially or completely block the tubes, preventing eggs and sperm from meeting. When the tubes are blocked, fertilization cannot happen naturally, which is why tubal blockage is a common cause of infertility related to PID. Another effect of PID is damage to the lining of the fallopian tubes. The tubes are lined with tiny hair-like structures called cilia that help move the egg toward the uterus. Infection and inflammation can destroy these cilia and damage the epithelial cells. Without healthy cilia, the egg cannot be transported properly, even if the tube is not fully blocked. This disruption also lowers the chances of conception. PID can also cause adhesions, which are bands of scar tissue that stick the tubes to other pelvic organs. These adhesions can distort the normal shape and position of the tubes, making it harder for eggs to reach the uterus. Sometimes, these distortions increase the risk of an ectopic pregnancy, where the fertilized egg implants outside the uterus, often in a damaged tube. Repeated episodes of PID increase the risk of tubal damage. After 3 or more infections, more than half of affected women may develop significant tubal problems. Besides scarring and blockage, PID can lead to abscesses and chronic pelvic pain, which can further affect fertility and overall health. From a fertility perspective, PID is a serious cause of tubal factor infertility because it damages the tubes' ability to capture and transport eggs. While endometriosis can also cause tubal damage, PID's infectious nature causes direct harm to the tubal tissue and cilia, often leading to irreversible problems. Treatment options include surgery to remove or repair damaged tubes, but these procedures carry risks of additional scarring. Often, in cases of severe damage, in vitro fertilization becomes the best option, as it bypasses the fallopian tubes altogether and allows fertilization directly in the uterus. Preventing PID is crucial. Early detection and treatment of sexually transmitted infections can help protect the fallopian tubes from damage. Safe sexual practices, regular screenings, and prompt medical care are key strategies to preserve fertility. Remember, if you suspect you have PID or are experiencing fertility issues, it is important to consult a healthcare professional for personalized advice and appropriate treatment options. In summary, pelvic inflammatory disease causes tubal factor infertility mainly through inflammation that leads to scarring, blockage, loss of ciliary function, and adhesions, all of which impair the tube's ability to support natural conception.